Good afternoon, everyone. My name is Dr. Tamu Nolfo. I'm Special Consultant with the Office of Health Equity within the California Department of Public Health, and I'm delighted that you have joined us here today. I wanted to let you know that this webinar is being recorded and will be posted on our website for future review, and in fact, you can click on the link that you have, I believe, in your Q&A box if you would like to have access to the documents that we currently have there, which include the most current version of the strategic plan and several other planning documents, and a survey that we welcome you to take. We, at this point, have 100 surveys that have been completed, and we will continue to compile and synthesize the responses to those surveys as we go toward the final versions of the strategic plan. Due to the volume of participants, you will be on silent mode or muted throughout this webinar. Please do ask questions by typing in the Q&A window. The green WebEx control panel tab is typically at the top center of your monitor. However, it may be in another location on your computer. And if you're experiencing any technical difficulties, we encourage you to call the number on the screen, which is 916-449-5918. So once again, welcome, and we're going to go ahead and get started so that we can have as much time as possible to answer your questions during the time that we have. We've allotted an hour for this webinar. So let's go through the objectives. I'd like to introduce the Office of Health Equity and its key duties and provide a context for the development of the statewide plan. We'll give you progress to date on that plan and share the most current version of the set of priorities and goals called the strategic framework. You may also have a set of initiatives and goals, as they had also been referred to. Engage with the stakeholders. So we'd like to engage with you to further the development of the strategic framework, which is becoming the statewide plan as it gets more filled out. And we'd like to identify partners to implement the plan. Once again, if you have any questions as we're going along, feel free to type them in the Q&A section. Before I get into talking more about who we are and how we came to be, I'd actually like to do a poll with you to find out who you are. And so we sent out the invitation for this webinar to a few distinct groups, as well as those individuals that were not able to participate in the last webinar that we conducted on April 16th because we actually reached capacity with our technology. So we had a little over 200 people who wanted to be involved on that webinar, and those that were waitlisted were invited to participate in today's webinar. And I noticed in looking at the registration list that some of you did make it on, so I'm happy about that. But what I'm going to do is just ask you if you could respond to the poll that you should see up on the corner of your screen. Are you a member? Let us know if you are a member of CCLHO or CHIAC or the Multicultural Coalition or none of those. Great. I'll give you just another moment to let us know. And I know that some of you are just calling in and actually don't have access to the screen. So I'll try to be as descriptive as possible if you're just listening. Okay, so I'm going to go ahead and close the poll. Thank you so much. So the Office of Health Equity was established fairly recently in 2012 to align state resources, decision-making, and programs to accomplish all of the following: to achieve the highest level of health and mental health for all people, with special attention focused on those who have experienced socioeconomic disadvantage and historical injustice, to work collaboratively with the Health in All Policies, or HIAP task force, to advise and assist other state departments in their mission to increase access to and the quality of culturally and linguistically competent health and mental health care and services, and to improve the health status of all populations and places with a priority on eliminating health and mental health disparities and inequities. And this was all established through the California Health and Safety Code 131019.5. So we have some key duties of the Office of Health Equity, let me make sure I can advance my screen. There we go. And they include to conduct policy analysis and develop strategic policies and plans regarding specific issues affecting vulnerable communities and vulnerable places, that the policies and plans shall also include strategies to address social and environmental inequities and improve health and mental health, and that the office shall assist other departments in their missions to increase access to services and supports and improve quality of care for vulnerable communities. And we also have some specific requirements of the statewide plan that we are mandated to develop. So we are to establish a comprehensive cross-sectoral strategic plan to eliminate health and mental health disparities and inequities. The plan shall be developed in collaboration with the Health and All Policies Task Force. It shall establish goals and benchmarks for specific strategies in order to measure and track disparities and the effectiveness of these strategies. And our first plan is due right around the corner by July 1st, 2014. There is also a report to accompany the plan. So in identifying and developing recommendations for strategic plans, the Office of Health Equity shall at a minimum do all of the following per our statute. Conduct demographic analyses on health and mental health disparities and inequities. The report shall include an analysis of the underlying conditions that contribute to health and well-being, and the first report is also due July 1st, 2014, and shall be updated periodically but not less than every 2 years, and made available through public dissemination, including posting on the department's internet website. So we are currently in the process of developing both the report and the plan. Together, we will be referring to the report and the plan as the California Statewide Plan to promote health and mental health equity. The California Department of Public Health is sponsoring the document. The Office of Health Equity is the keeper of the statewide plan and will facilitate the planning process. We invite input, expertise, and decision-making help from the advisory committee and other stakeholders, but the Office of Health Equity submits the final plan to the California Health and Human Services Agency for review and approval. As part of the statute, we have also created an advisory committee, and the advisory committee is to consult regularly, with this advisory committee established by Subdivision F of the statute for input and updates on the policy recommendations, strategic plans, and the status of cross-sectoral work. The advisory committee consists of a broad range of 25 health experts, advocates, clinicians, and consumers who are helping to advance the goals of the office and advising in the development and implementation of the strategic plan. And you can see that they are listed here on your screen. So they come from a broad background. There are researchers, there are practitioners, there are consumers, advocates, and they have been meeting since September of 2013. They had a two-day meeting in September, a two-day meeting in January, a two-day meeting in March, and they have one coming up next week, May 12th and 13th, and those meetings are open to the public. The Health and Safety Code gives us some definitions to work with, including health equity, which is defined. Health equity means efforts to ensure that all people have full and equal access to opportunities that enable them to lead healthy lives. And we're providing a little bit of a streamlined version of this presentation in this webinar as opposed to the one on April 16th, if you're looking at slides for the webinar from April 16th, just so that we can make sure that we have enough time to fully answer any questions that come through. So what you're looking at is a graphic representation of how we are envisioning achieving health and mental health equity at every level. We're looking at transforming the conditions in which people are born, grow, live, work, and age for optimal health, mental health, and well-being. And so what we know is that health exists in many domains in our lives, from the individual and family domain, moving further out into our community, where we have home, school, work site, and neighborhood. Another ring out is our environment, which is at the level of town, city, county, or rural environments, and the furthest domain out of society, which is looking at state, federal institutions, foundations. And so we're impacted throughout all of these domains in all of the areas that you see listed around these domains. And so these are the areas that have actually been called out in the Health and Safety Code that we are to look closely at, to look at where the disparities are. They're a part of the report, of the disparities report, for us to see what are our indicators around the disparities in these particular areas. We have prevention, mental health services, culturally and linguistically appropriate and competent services, income security, housing, neighborhood safety and collective efficacy, environmental quality, discrimination and minority stressors, built environments, food security, nutrition, child development, education and literacy rates, and health care. So these are all areas that we're looking at where we're really combing through the data to understand where the disparities exist. So what we're looking at on the screen now is actually a model that comes to us from BARHI, the Bay Area Regional Health Inequities Initiative. And I should mention that we do have Sandy Galvez on the line as well, who's able to answer questions for us when we get into the question and answer period or through the Q&A chat. She is the chair of our committee, of our advisory committee, and leads BARHI. And so one of the things that we've been able to look at is different ways of understanding how to get to health and mental health equity. So this is a public health framework for reducing health inequities. And what we have seen from traditional public health practice is more on the right-hand side of the screen, what we would call more of the downstream practices, looking at mortality, looking at disease and injury and risk behaviors, and focusing our efforts on health care and case management and individual health and education, which are all incredibly important for people who are suffering from disease and injury. And so that is one part of the picture, but what we have failed to do is to look as far upstream as we can and to put more of our resources and attention in the upstream direction. But that is beginning to emerge in public health practice, and that's what we want to capitalize on. That's what we want to build on. And so that's where we start moving more into looking at what are the living conditions that shape our lives, where it is that we're born and we live and we work and we play and we age. So what do our physical environments look like? And within our physical environments, we have land use, transportation, housing, residential segregation, exposure to toxins. We have our social environment, which is the experience of class, racism, gender, immigration, and our culture, ads, media, violence. Then we have our economic and work environment. So we're looking at employment, income, retail business, and occupational hazards, and our service environment, healthcare, education, and social services. And that's where we have some opportunity to do community capacity building, community organizing, and civic engagement. And as you go more to the left-hand side, further upstream, we look at institutional power within corporations and businesses, government agencies, schools, laws and regulations, and not-for-profit organizations. And there, too, we have an opportunity to do strategic partnerships, to do advocacy, and looking even further upstream is where we must pay attention to the social inequities that are really driving so much of this, which is class, race and ethnicity, immigration status, gender, and sexual orientation. So that's where a large focus of our efforts are coming from as we're developing this plan, is can we look upstream? Can we have a better balance around the policies and the practices in public health? And just to illustrate that, we see that there are communities that sometimes are neighboring, and yet they have very different outcomes. So here in Sacramento, where we are, we have, for example, two neighborhoods that are very close. In fact, they share a border, 95819 and 95817. Each one has about 15,000 residents, but in Oak Park, the residents are more than 3 times as likely to go to the emergency room for asthma, diabetes, or high blood pressure. That's just one example where we see that the conditions in which people live are definitely shaping their health outcomes. We have another example in Marin County, which we know to be a very wealthy county, but when you drill down within Marin County and you look at 2 cities that are very close to each other, when you look at Marin City and Ross, there is definitely disparity in the lives of the residents of these two places. Some of the facts about Marin City and Ross, that Marin City has an African-American population of about 38%, and in Ross, the African-American population is only 0.2%. In Marin City, about 39% of the residents live below 200% of the federal poverty level, and in Ross, that number is just about 10.7% of the residents live below 200% of the federal poverty level. What we see is in Marin City an obesity rate of almost 15% and a 0% obesity rate in Ross. The life expectancy in Marin City is 78.6 years, and in Ross it's 94.4 years. So this is why we're really trying to pay attention to the conditions in which we live, because those conditions are really shaping our lives, and they're also shaping our behaviors. And we want to make the default to positive behaviors and also to minimize the impact of the conditions that quite often we have very little control over. So as this advisory committee was coming together, they started working on their strategic planning process in January of 2014 and developed a vision, a mission, and a central challenge, which you can see up on your screen, that the vision is that everyone in California has equal opportunities for optimal health, mental health, and well-being, that the mission is to promote equitable social, economic, and environmental conditions to achieve optimal health, mental health, and well-being for all, and the central challenge is to mobilize understanding and sustained commitment to achieve health equity and improve the health, mental health, and well-being of all. And so what I would like to share with you now is where we're headed with our strategic plan. So as we're looking at what our priorities are and what the goals are that accompany those priorities, as the advisory committee was coming together along with the staff of the Office of Health Equity and members of the public and grappling with how to achieve this mission and vision and really address the central challenge that was laid out on the previous screen, these were some of the questions that were surfacing. Do we have the information we need to move this work forward? Are we well connected with others who are doing this work? Are we providing solutions? And when we came to the realization that we didn't necessarily have the information to move the work forward, that we weren't necessarily well connected with others, that we weren't necessarily providing as many solutions as we could, we realized that we needed to create a priority that would lead us in that direction. And so the priority that came out of those conversations was to identify and disseminate actionable information on inequities and disparities. And so we have a polling question for you to understand whether you would like to be involved in helping us move forward this work. If there were an opportunity for you or your organization to engage in this initiative or in this priority, would there be a strong enough interest to do so? So I'm going to go ahead and open that poll, and you can use the polling feature to let us know your response to that. The way that this plan works is that it's really a plan for everyone in the state, and actually there are national organizations as well who want to be involved in this plan and should be involved in the plan, that it's being created in such a way that everyone should be able to see a role for themselves. And so I'll go through what some of the goals are that we've identified underneath this plan. Underneath this particular priority area. And we've broken them out into what we think is reasonable to accomplish in the next 3 years, which we're calling Phase 1, and then what we think can be accomplished in the 2 years after that, which we're calling Phase 2. And so naturally, Phase 2 will build on the successes of Phase 1. Phase 1 is a lot about laying the groundwork, laying a foundation for us to be able to accomplish this work together and be successful and sustainable moving forward. And so the goals that we have here in Phase 1 are to assess and build broad-based community support on health and mental health equity issues through education and dialogue, heightening awareness of the social determinants of health. The second goal is to build a network of communication and support for health and mental health equity work statewide. The third goal is to develop and host an interactive, informative, and engaging state-of-the-art website with timely, accurate data, relevant research, and evidence-based and community-defined practices. The fourth goal is to develop and disseminate technical assistance briefs based on recommendations from the Office of Health Equity Advisory Committee. The fifth goal is to partner on existing annual health equity summits for practitioners and policymakers. The sixth is to build awareness of and mobilize resources for assets that strengthen the state's data capacity and are driven by social determinants of health, and to encourage their use for planning purposes. And goal 7 is to assess health and mental health equity data shortcomings and explore feasibility of creating new data and or disaggregating existing data. So once again, it gets back at these questions that we have about, do we have the information we need, are we well connected to each other, and are we providing solutions? So it looks like you have gone ahead and done the polling question there, whether or not you would be interested in participating in this particular priority, and I appreciate that. So I'm going to move on to our next priority area. Which is to embed health, mental health, and equity into institutional policies and practices across non-health fields. And I'm not quite sure whether we should call them non-health fields, but it's more the fields that we haven't necessarily considered to be health, or they haven't necessarily considered themselves to be health, but that we have come to understand actually impact health tremendously. So they would be transportation and housing, that there are many fields that are not within the traditional purview of health that we need to enlist. So the kinds of questions that we grappled with in coming up with this particular priority area include, do we know the extent to which we can have an impact outside of our traditional health partners? Do non-health institutions have the information and incentives they need to be good promoters of health and mental health equity? And can we think as large as reducing greenhouse gas emissions to protect our most vulnerable communities? So we're really trying to understand what can be done out of beyond the traditional approaches that we've had in the past and working with the traditional partners that we've had in the past. So some of the goals that have come out of that for the first phase include conducting a general landscape analysis of equity practices in the non-health field, to use a health in all policies approach to embed health and equity criteria in decision-making, grant programs, guidance documents, and strategic plans, to enhance understanding of climate change as a public health issue of increasing importance for the state's most vulnerable populations and promote widespread efforts to reduce greenhouse gas emissions, achieve health co-benefits, and enhance climate resilience for vulnerable and disadvantaged communities, and facilitate common understanding of health equity and the social determinants of health between non-health agencies and organizations. And so we have a polling question for you about this particular priority area. And I'll go ahead and open that poll. If there were an opportunity for you or your organization to engage in this initiative or this priority area, would there be a strong enough interest to do so? And go ahead and mark your answers for us. Hopefully you're submitting your questions through Q&A. We stand by ready to take your questions. Okay. And if you have questions specific to any of these priority areas or these goals, I will absolutely do my best to answer them for you. Just go ahead and type them in to the Q&A. But I'm going to close out this poll and move on to our next priority area. Waiting for, okay. I'm sorry, the technology was wanting me to wait for a few more seconds. Okay, so then we move on to our strategic priority C, which is to embed equity into institutional policies and practices across the health field. And so once again, we're looking at where can we be most effective and what do we even know at this point. And so do we know where our health field is missing the mark? Could we provide better support to strengthen and expand the field? And how can we maximize the opportunities posed by the Affordable Care Act and protect those who will continue to be uninsured? So when we realized that, yes, there were absolutely opportunities for us to improve in these areas, for us to get a better understanding of where the health field is missing the mark, to provide better support to strengthen and expand the field, to really maximize those opportunities through the Affordable Care Act, that we needed to have a strategic priority that would address those areas. And so that's the one that we have here, embed equity into institutional policies and practices across the health field. And I will share with you what the goals are for the first wave, the first phase of this strategic priority C. Goal 1 is to conduct an assessment of health and mental health equity practices throughout state departments and state-funded programs in the health field, to facilitate common understanding of health and mental health equity and the social determinants of health between all departments that fall under California Health and Human Services. What you'll see in the next phase is that we expand that out beyond California Health and Human Services. Goal 3 is to support the expansion of culturally and linguistically appropriate services or CLAS, including assessment, technical assistance, and training. Goal 4 is to explore strategies to reduce differential access to the opportunities presented through the Affordable Care Act in covered California and the feasibility of enacting the strategies. And Goal 5 is to enhance understanding and action on climate change as a critical public health issue that is likely to impact vulnerable populations in disparate ways. So we have the same polling question for you, but we also have Sandy Galvez, who would like to speak. And so, Sandy, if you'd like to unmute your phone so that we can hear you.
Actually, no, I didn't want to speak. I accidentally hit the raise button.
Well, welcome. Welcome to the call, Sandy. Okay. So I am trying to pull up this particular poll. It's giving me a little bit of grief. It says, I'm sorry, I want to check with my IT person. Interest in participating fraternities, but I want it to be D. Is that wrong? I'm just going to change it. Okay, so you should be able to poll on that question now. If there were an opportunity for you or your organization to engage in this initiative or this strategic priority, would there be a strong enough interest to do so based on what you know at this point? Go ahead and mark your answers for us. And, you know, I changed it. I actually made a mistake. I thought that we were on D, but we were on C. And so that should say C, but it says D for you. But we are actually referencing strategic priority area C. So go ahead and mark your results if you haven't, and I will close out the poll, and we'll move on to strategic priority D. Okay, great. And there we go. So once again, the kinds of questions that we were grappling with that led us to strategic priority D are listed on your screen. To what extent is there work being done throughout California's communities to reduce disparities? How can we more broadly replicate effective efforts that are already being done on the ground, and how can we encourage the initiation and sustainability of local efforts aimed at the social determinants of health? So this really was about empowering communities in inequity and disparity reduction initiatives. How can we go about understanding what's already being done, and how can we move those activities into more places to be able to broaden the scope and the impact of those activities, to learn from those activities? That's really the impetus behind strategic priority D. And to get more people involved in doing this work locally, understanding this work locally, embracing this work locally. So I'll share with you what the goals are that have come out at this point for strategic priority D. Goal 1 is to conduct a scan to determine how local communities are currently mobilizing to address the social determinants of health and how they are measuring their success. Goal 2 is to explore the feasibility of initiating local initiatives to increase health and mental health equity in all policies. And Goal 3 is to mobilize resources to reduce mental health and community health inequities and disparities. And this is actually an area where, as the Office of Health Equity, we will be devoting a lot of our time and our resources through the California Reducing Disparities Project within Goal 3, mobilizing resources to reduce mental health and community health inequities and disparities. But all of these goals have been developed in such a way that there's room for multiple partnerships, that it's not just what the Office of Health Equity is able to do. There are limited resources within the office, but it's really about how can we help to create a vision that we can all be a part of, and how can the office help to coordinate that vision. So with that, I'm going to pull up your next question and open that poll for you. So if there were an opportunity for you or your organization to engage in this initiative or this priority area, would there be a strong enough interest to do so? And go ahead and mark your answers for us. And there are two more strategic priority areas. So I'm going to close out this poll and go through those last two areas. In strategic priority E, the priority is develop and align sustainable multi-sector infrastructure and support. So when we're really looking at being able to accomplish this work over the long term, what is it that we need to be able to do that? So some of the questions that drove us to this particular priority are, how can we build a workforce that has the capacity to effectively dismantle health and mental health inequities? And how can funding criteria and priorities be leveraged across sectors? And what are the opportunities to capitalize on national and other efforts that are already underway? So I'll share with you what the goals are that have come out up to this point under this particular priority area. Goal 1 is to develop workforce development opportunities aimed at increasing the capacity of state employees to effectively address health and mental health inequities and disparities. Goal 2 is to recommend that health and mental health equity be embedded as a priority in existing funding streams at the state, local, and private level. Goal 3 is to closely monitor progress on the National Health and Human Services Action Plan to reduce racial and ethnic health disparities and other plans and entities that are addressing the needs of historically underserved communities and seek opportunities to increase California's role. And Goal 4 is to identify potential health equity zones at the neighborhood level. So the health equity zones were an idea that came out of one of the advisory committee meetings, and I'll share with you what we know about health equity zones. The Division of Community, Family Health, and Equity at the Rhode Island Department of Health has created a model for cross-program integration that includes pooled community investment grants in high-need communities called health equity zones, each with the Center for Health Equity and Wellness. The model includes a statewide Healthy Places Learning Collaborative and web-based resources, tools, and on-site technical assistance for communities, uniform contract language for all health contracts to communicate expectations for implementation of health equity work, a collaborative network of state and local stakeholders from multiple coalitions and interest groups doing cross-program state-level strategic thinking, and an online relational mapping database of community assets and gaps to ensure that investments and partnerships result in the greatest reach and impact. So we intend to explore the feasibility of replicating the health equity zones model in high-need California communities. So I am going to open up your next polling question for you. If there were an opportunity for you or your organization to engage in this initiative or strategic priority, would there be a strong enough interest to do so? If you would please mark your answers for me, I'd appreciate it. I'll give you a moment, and I'm going to close out that poll and move on. And so this is our final strategic priority area, capacity building for implementation of the strategic priorities. The first time that something is done is often the most exciting and the most challenging. It can also be the most rewarding. So we feel like we're at this historic moment for California in launching our first ever statewide plan to promote health and mental health equity. We've had hundreds of stakeholders that have really leaned in to be a part of this process, and we know that that's only going to grow over time. But there's also this tremendous responsibility in ensuring that this hope that is being fostered is actually able to take off, that it's not false, that the groups that have historically been omitted from the conversation are really welcomed, and that our visions for change are enacted. So to move the plan from a strategic conversation to a tactical one, we have embedded a set of goals to guide and support our implementation efforts. As the facilitator of the planning and implementation processes, the Office of Health Equity intends to build capacity for movement on its strategic priorities. First and foremost will be building mechanisms for ongoing public engagement and accountability. This will enable meaningful participation of stakeholders to engage in how the goals are prioritized, who will be involved in their implementation, and important considerations that need to be made along the way. And the mechanisms will likely include both the use of technology and personal interaction and will be designed for maximum participation and transparency. And you can see the questions that led us to this particular strategic priority are on your screen. How can the Office of Health Equity be as transparent and accessible as possible in the planning and implementation of the statewide plan? Can the strategic priorities catalyze partners and resources? And how can we build the capacity needed to effectively deliver on the statewide plan? So some of the goals that we have in the first few years are Goal 1, to build a mechanism for ongoing public engagement and accountability on the strategic priorities. Goal 2 is to strengthen the health and mental health equity workforce development pipeline by utilizing fellows and interns in the implementation of the strategic priorities. Goal 3 is to identify new resources and redirect existing resources to support the strategic priorities and provide leadership to align resources in support of health and mental health equity. And the fourth goal is to identify and foster public and private partnerships for all appropriate strategic priorities, including governmental, corporate, educational, research, and philanthropic institutions. And so I will go ahead and pull up your next polling question on priority area F. If there were an opportunity for you or your organization to engage in this initiative or strategic priority, would there be a strong enough interest to do so? And we're going to close out the poll in just a moment. Great. And so I wanted to give you a snapshot of our timeline. As I mentioned, we started doing strategic planning with the advisory committee and the public at the meetings that were held in January and March. We did have a webinar to involve stakeholders in this process and help them understand the things that we're going over on the phone today, on this webinar today, and that took place on April 16th. What we did between April 16th and the 25th was to collect, review, and incorporate feedback, public feedback, into the strategic plan and made some revisions to the draft strategic plan. And so this is a very fast-moving process. There are multiple versions of the plan that have been developed over the last couple of months. In fact, there is a new version that we updated just this morning, which is version 3.1. You may have that, or you may have version 3.0, or you may have version 2.0. But I want you to know that on our planning page, and the link you have there in the Q&A box will take you to the most updated version, which will continue to be updated. So let's see, so between April 28th and May 9th, our date today, we're making revisions to the draft strategic plan, just as I mentioned to you. We are having another advisory committee meeting May 12th and 13th, and that's here in Sacramento, and the public is welcome to attend or to call in, and all of the information about that meeting is available on our website. We will be taking public comment and feedback from the advisory committee through the end of the day on May 13th, and then we need to synthesize that feedback and make final revisions to our draft statewide plan through May 23rd, and then we need to make internal administrative review and approval processes or engage in that process. So we have from May 26th to June 30th to do that, and on July 1st, we will have our final statewide plan posted onto our website. We have ongoing stakeholder engagement and accountability on the planning and implementation, and there are two levels of planning. There's the one level of planning that's happening now around the strategy, that the legislature needs to feel comfortable with where we're heading with our strategy. Essentially, are we going in the right direction? And so that's where we're headed with our strategic plan. Plans also have an implementation plan or a tactical plan to accompany them, and that is also in the process of being developed, but because we want to have as much public input on that plan as possible, and that can't be accomplished by the July 1st deadline, that is going to go on. So we are starting to write that implementation plan based on what we can commit to with the resources that we have within the Office of Health Equity that are going to get at some of the goals and the strategies that are currently in the plan. We are also going to be asking the advisory committee members what it is that they can commit to during the meeting that we're having next week, and we do have other organizations and institutions that have said that they see themselves in this plan as well. And so we're going to continue to flesh that out. Essentially, we're going to have the first blush of that when we submit our plan for the July 1 deadline, but then we're going to continue working on that implementation plan for several months after the July 1 deadline to make sure that all of you have the opportunity to really engage with us in the ways that you see yourself in this plan. So that's what we're looking at, and we're looking at providing updates, and whether that is webinars or public forums or conference calls, but there will be many ways in which we are able to let you know what is happening with the planning process and to continue to seek your engagement in it. So I do have some more polling questions for you. We have a little bit more time on the webinar. If you have questions, I encourage you to submit them through the Q&A. And I'll pull down these questions for you. So this question that I have for you is, to what extent did the webinar meet your needs to better understand the planning process? And you can let us know fully, mostly, moderately, or marginally. I'm going to open that poll for you and go ahead and mark your answers. I'll give you a moment to do that. You have been a very quiet group. We were expecting lots and lots of questions as we had on our last webinar. So I'm either going to take that as a good sign that we anticipated your questions and answered them. I'll just take it as a good sign. And so I'm going to go ahead and close out that poll. Good. And we have another question for you. To what extent did this webinar meet your needs to better understand the proposed priorities and goals? And once again, your answers can be fully, mostly, moderately, or marginally. And I will open that poll for you. And if you have not pulled down either version 3.0 or 3.1 of the plan, then you don't have the narrative to help to explain better what the priorities and goals are. So I would encourage you to pull that down. And I'm going to close out that poll. And the system is telling me that some of you are still responding. I'll give you a moment to do that. And we will be closing out this webinar in just a few moments unless there are questions that come through. I have one more polling question for you. Sandy, if there's anything that you wanted to say before we close out, by all means, feel free to unmute your line. And your last polling question, are you interested in participating in future Office of Health Equity webinars? And your responses are yes, possibly, or no. And I will open that poll for you. So as I mentioned, we are collecting public comment. We are continuously updating the plan based on the comments that we're getting, on the feedback and input that we're getting. If you have not yet completed your survey on our SurveyMonkey link, I strongly encourage you to do so by the end of the day on Tuesday, the 13th. That link is found in your Q&A chat, and it goes to our planning page. You are welcome to complete that SurveyMonkey survey by yourself or with others. There are only a couple of responses that are required, and the rest of the responses, it is up to you whether you want to fill out the entire survey or if you want to skip around and fill out the parts that you that are most meaningful to you, but essentially it's helping us to prioritize the goals that we have and to understand what kind of work is already being done and what kinds of partnerships we should be looking into. So it's a great opportunity to hear from you. Since you've been very quiet on the line today, then we'll look forward to getting your surveys if you haven't gotten them in. So if there is nothing, yes.
Andy, I did want to say something.
Go ahead.
So, the polls have given us some sense of how many folks would like to get involved in the implementation of the plan at a future date, but I thought it would be useful to share if there are any ideas coming out of the office of ways for people to get involved in the implementation of the plan once it's been submitted in July, or if anybody has comments about that they'd like to make in the Q&A, please do so.
Yeah, it's a great comment, Sandy, and that's one of the things that we'll be talking about at the advisory committee meeting. So some people have been very specific to us in their comments around where they see themselves. So, for example, there are limitations to what we can do with a website as a state agency, and so an agency has said, well, we can help with a website, with building out this really engaging and interactive website that you envision, and so that may be a partner that we really want to engage in on that level with that particular goal. And so that's one of the things that we're looking for is, are there specifics where you would see yourself as an organization having a strength to move forward a particular goal. What I would envision is that we would be having meetings with those partners who did want to sit down and talk about how they would show up in this plan. And so whether those are face-to-face meetings or whether those are phone meetings, whether those are group meetings, because what we'll be doing is combing through and looking at all of the partners that have indicated an interest in various priority areas or specific goals, and just closely seeing who they are, where are they, does it make sense to bring them together for us to talk about that together. But that will be happening over the summertime and early fall so that we can hammer out as much as we can moving forward. And we'll need to know, do partners have the resources to move forward particular goals, whether that's human resources or financial resources, or what do they think that they would need in order to move forward those goals, because there may be an opportunity for us to solicit resources from other partners or other funding sources or whatnot to be able to make that happen. And I hope that answers that for you. Do you want to add anything to that, Sandy? I know that there has been some discussion, for example, from stakeholders who want to see their particular community show up explicitly in the plan. And, what we've seen from, or the feedback that we've gotten from the advisory committee at this point is that it's not at that level from the strategic standpoint, but it is at that level at the implementation standpoint. And so if there are particular communities that warrant attention for us to be looking at through this plan, then we would want to know that. And so there are no more questions, my silent group. Then go ahead on to the survey. By all means, please enjoy the rest of your day. We hope to see you or have you on the line at our meeting, the advisory committee meeting, next Monday and Tuesday. And we will keep you posted. We'll keep you updated. Be sure to check back regularly to the link that you have on our planning page, because we will be posting updates as we have them. All right. Take care.